So who are we waiting on, Kathy? So I see Bianca and you and me and Monica.
Monica, yeah.
Yeah, I'm here.
Got 4 of us. So
I think that's it, isn't it? No. Who else is on it? I'm trying to think.
Mary Slaughter will not be joining us today.
Okay.
And
Megan?
I never heard back from Megan. So I don't know. I have to assume not, but I didn't get a response from her.
Okay. All right. Well, good morning, everyone. It's nice to see you on this bright, beautiful day. I'd like to call the Work Plan Review Committee meeting to order. And shall we do roll call? Marcy, do you mind doing that, or do you want me to do it?
I'm happy to do it, Kathy. Good morning, everyone. I'll start with the committee member. So Kathy, we'll start with you.
Hi, Kathy Lewandowski, Work Plan Review Committee Chair and ADDPC Council Member.
Thank you. Bianca?
Morning, Bianca Tamara, ADDPC member.
Great. Melissa?
good morning, Melissa Van Hook, Council Chair, Committee Member, and Chair of the Meaningful Careers Committee.
Great. And then Monica?
Council member and chair of the grant committee. I don't know. That's the way I remember it.
Yes, you are correct. Thank you. We have pretty much all staff except for Jason, but we'll go ahead and do intros. John?
Good morning, everybody. John Myers, Executive Director.
Sarah?
Hi, everyone. Sarah Roof, Communications Director.
Michael?
Good morning, everyone. Mike Leva, Contracts and Grants Coordinator.
Great. And Lonnie?
Good morning, Lonnie St. Cyr, Fiscal Manager.
Okay. All right, Kathy.
Thank you. Okay, our next business is approving the draft minutes from the July 31st. July 31st Work Plan Review Committee. Can't believe it's been that long since we've met, but time goes by fast when they're having fun. Do I have any questions, or has everybody had a chance to review the draft meeting minutes?
Yes.
Do you have any changes?
Yes.
Okay. Do I have a motion to approve the minutes?
So moved. It's Melissa.
Melissa, do I have a second?
This is Bianca, I'll second.
Okay. All right. So any nays? I don't know if I should say that. Actually, okay. So let's take a vote. All in favor of approving the draft meeting minutes from July 31st, 2025, please say aye.
Aye.
Any nays? Okay, the draft meeting minutes have been approved for July 31st. Okay. Yeah. All right. So next on the agenda is the 2026 annual work plan draft, and John and Marcy are going to discuss that with us.
All right, I'm going to just sort of set the stage and then turn it over to Marcy, because she is the expert at this. Basically, we are operating on the assumption that the 3 goals and the various objectives under those goals that were approved by the council at the January meeting are what we will be working on moving forward into 2027 and beyond. The comment period is still ongoing. It closes next Thursday, the 19th, but so far we have not received any substantial comments that would require us to put the goals and objectives out for a further 45-day public review. So we feel as though at this point anyway, it's safe to proceed believing that these will be the goals and objectives. To that end, we have gone through as staff and developed a series of activities under the objectives that we believe are appropriate for next year. Some of these are renewal of current projects that we are being funded or led by the council. Some are suggestions for new activities that would need your input. And then in some cases, because, and Lonnie can probably address this, we will have some excess funds based on what we have on the pages here. And so we need to figure out a way to utilize those funds, and we are looking for recommendations from you on where we might go with the utilization of that money. So I think in a nutshell, that's kind of where we are. But Marcy, if you would like to take it away and add anything that I have left out, please do so.
Sure. Just a big picture overview. The goals, there are 3 goals. There are brand new statements. There are 7 objectives. Those are all brand new statements as well for the next 5-year plan. And with the exception of the 3rd goal that has the emergency preparedness statement, kind of like we will collaborate, among different agencies and partners if there's some big nature issue going on. That particular objective on the 3rd goal, 3rd objective is something that all councils have to put in, but we do not have to address it every year unless there is something that happens in the state of Arizona where we put in an action. My understanding with John and from other staff is there's already ongoing work around this area, but we want to make sure that it's listed here and we report on it when necessary. So kind of a big picture there. Again, 7 objectives, 3 new goals. Pretty much the first 2 goals have 2 objectives. Objective 3 has 3. So as John stated, we had to look at 2026 to see what was going to continue, what we asked staff to really be cognizant of that, like what should continue, what should carry over. And what we're carrying over from 2026 is approximately 20 projects. And that includes staff-led projects and funded projects. And the funded ones are because there's several new contracts that we have with the USEDs that began last year that possibly will need an additional year of funding to complete. And there are some that are going to be going on for a 3rd year or possibly a 4th. We also identified 4 new activities in this work plan where some of them are going to have funding tied to it, others will not. And you'll see that as well as we go through it. And as Lonnie will say, we do have a pot of money that we do need to work on obligating. And we do need ideas from this committee, from the council on possibly, what you think would be best and where it would fit. So that's kind of the big picture of what I wanted to get through. The last thing is, have to excuse me because I get out of breath very easily. You'll see a 3rd line. I'll cover that kind of, very quickly what the purpose of that is, where we add a year the project was listed, the year the project is expected. That's going to change, and the justification for it is going to change. It's a new line item that I talked to John about, and he thought it would be helpful. I think it's going to be helpful for you guys and for the councils because we do have so many projects carrying over. Some of those projects have already been working on for 5 years, possibly even the previous 5-year state plan, but I'm not going to go back and look at anything. And it's really to think about why are we doing this project and what are we getting out of it and what are we reporting in terms of outcomes to the feds? What are the storylines that we are working on and continuing to report where we're making an impact? And knowing that some of these things are systems change, then what is the impact on the system if we're carrying over a particular project? And it's really to be engaging with staff and for us to engage with you and for all of us to kind of keep in mind that, we need to think about, our resources being utilized in the right space if there's something else we should be looking at. And so it's to get away from trying to continually to just do something just for the sake of doing it. So you ask us those hard questions, we should be asking ourselves these hard questions. So if you see a project listed there that has a previous year and we're not clear about when it's expected to end, or we're carrying it through the next 5 years, then what are we hoping to achieve that ties back to this objective where we're reporting on that we're making improvements to the objective and meeting the goal, because everything has to be tied back to that. So it really is just to kind of think about each of these activities in a little bit more thoughtful manner. Okay, that's my quick overview. Monica, you have questions?
Yes, I did. I just wanted to make sure I understood. So like the committees, like, for example, meaningful careers and stuff like that, that may change. How is that going to affect us going forward in the new plan when things are going to change?
I'm not sure I quite understood your question. If someone could kind of paraphrase or can answer.
Like I was just wondering, I mean, as our committee, as our work group is changing as far as, what goals and everything, I mean, some are going to be the same, but the one, like, if we change some of it, how will we be able to finish those grants that need to be finished if we have different goals that don't go with what the original grant was for?
There's not going to be that much change. So anything that is related to a competitive grant or to or direct contract with the universities, with the USETs, that process is still going to be in place to follow through for the council to review and make the ultimate decision to award the funds or not. So the only thing that's changing is we're making sure that they fall within the right objective and under the right goal. So we're still working on those activities. They are still being fit under the right objective and the right goal. So just remember, a goal is a very broad statement of what the council wants to do. And then the objective is just a little bit more specific, and each activity should be very specific to that objective. So it's not going to be too much of a stretch to continue some of these projects and fit them under the right objective. Now, if someone feels differently about where we put something and we think it fits somewhere else, then we want to make sure that we have that correct. So we're, the mandatory activity, that all councils have to address is the self-advocacy leadership one. And that one is listed as a priority under the third goal. And we want to make sure that that statement is broad enough. The goal statement and the objective is still encompass the self-advocacy work that's being done by Arizona Achieve, as well as some of the other work that's continuing on, such as support decision making, for example. That's going to be something that's going to be addressed going forward as well. So we want to make sure that we leave these statements with some flexibility to allow these projects to continue.
Okay. That's why I wanted to make sure.
Yeah.
I knew self-advocacy was a mandatory.
Right. And though we didn't list it as a goal statement or an objective statement, we're making sure that we can address it as an activity because it is a mandatory, and we're still going to be working on it.
Okay.
Does that help?
Yes, it does. Thank you.
Okay. What would be helpful, Kathy, going forward for how to look at this, as I gave a big picture kind of overview?
Let me ask my question first, and then I'll try to answer yours. So when we started the state plan development group, and we were working with the consultant, she indicated that there was so much on the other work plan that it was difficult for the staff. It was difficult for the staff to get everything done. And the goal was to try to, reduce the amount of activities and goals so that the staff could accomplish these things. And when I look at this, you have a lot of activities. We may only have 3 goals and 7 objectives, but there seem to be the same amount of activities as when we had the old work plan.
It's quite less. It's almost half.
Is it? Okay, because I hadn't looked at it to compare yet. Just even here, it looks like, oh, this is a lot to do.
Yeah, yeah. No. We're at 24 activities among the 3 goals, and at the height of the current work plan we're in, 2026, we dropped some activity. So it looks a little bit less this final year, as it should, because some things should fall off or should be completed. But I would say 24, 25, we were well over 40 activities. We were doing everything and anything under the moon.
Okay. Well, that is good to know, because I was thinking, oh my gosh, I don't think we've reduced any of your activities, and I had concern with that. Okay, so then your next question was, how do we think we should proceed with this work plan to see if we, as a group, we understand it, and you want our suggestions on the activities, correct? And there was a
Right.
certain,
Right.
there was,
I think what's going to be helpful is I think most people are familiar with the existing ones, and we'll go through, I think we could go through each of these and point out the new ones and look at and just make sure you guys understand, we put in at least a statement of what we're hoping to do. We don't have any more details than what's in this plan. There is, Lonnie will jump in, I hope she does, about how much money is still left for us to figure out, so that we could go ahead and get ideas from you about, additional new projects to add, because we only have 4. And so we'll cover that in here. And the other thing I just want to make clear is this is just the first year. Even the feds are confused. It's really funny to me. In a training we were recently on, they don't even know if they're going to require 2028 to be submitted. So, if it does, it's fine. We kind of project, and then we make the amendment. We could change that, at a later year, update 2028, but they at least need 2027. And here's how I think, for most of you, the council members who have been on this, on the council for a very long time, we add new projects as things come up and things develop with our partnerships and with our collaborators. And as you guys give us feedback, to add new activities going forward. So what you see in 2027 may not necessarily be the final, some activities may not be the final, continuing on through the final year of 2031, so, we will be coming back to this committee, to the council, to say, we're going to be adding some new things because, this is emerging, and we want to be a partner, and we think we have, a way to collaborate or to spend funds. And so we're always going to get funding. And so we're always going to have to come up with ideas as well. So just know that this is not static. Every year on August 15th, we submit an updated new plan for the feds. And so 2028, if we don't submit it this year, we'll be going in next year, and then 29 the following year, and 30. So you continually to update this plan, so that it's reflective of what the council wants to work on for the year. So just keep that in mind. So, and let me just toss this to Lonnie really quick, because I think that would be helpful to know what the dollar amount is that we're looking at.
Okay, give me a second to see if I could share my screen. What I'm going to share should be seen as, very fluid. So it should encompass everything that is in the work plan that we're going to discuss today. It's based on the 3 new goal areas, and these are kind of placeholder names for the goals. But as you can see, this is kind of what's broken down. These target areas really disregard at this point, but these are the funded activities that some will be carrying over, some are new. Some of the amounts have yet to be finalized. So some of them are solid, some of them are penciled in. So there is some flexibility here. And just know, it's an ever-moving target with what we're spending. We don't have our notice of award yet for our 26 funds, so we don't even know what the true amount is. I'm kind of basing our award on level funding. This is kind of what we have per goal area. And then if you're looking down here, we have approximately, let's just say $100,000 to still allocate. So if you guys have some ideas on, you know, possible new projects, because again, I think we want to start fresh in some sense with what we're doing. I mean, it's a new plan. Let's have some new ideas. But at the same time, we need to carry some of these new things over because a lot of these projects just started last October. And so we don't know whether or not those projects that started in October will necessarily be successful and should carry forward, but we've penciled them all in. We don't know if they'll need additional funding. So again, there's a lot up in the air with this, but right now we're kind of estimating around $100,000 that will need to be allocated to something that we have not identified. For example, this healthy lifestyle pilot, I've dedicated $50,000 to that right now. It would be a new solicitation. That $50,000 can go up, it could go down. We could decide we don't want a healthy lifestyle pilot, but this is just something that we've identified and it's part of the plan that Marcy will be going into further detail with. But so yeah, based on kind of where we are right now and a whole bunch of unknowns and ever changing everything, let's look at $100,000 to be allocated and identified for a new project or projects. And this is again, $26 to be spent in 27 projects. Any questions on this?
No, I think that's helpful. I liked on your spreadsheet that what you had, which I kind of would like to see on this work plan, is you have your target numbers, which that was one of my questions as we were going forward. You say 23 trained on the data hub. Seemed like that would be nice to have it incorporated into this work plan. I think when you think about healthy lifestyles, I'm not quite sure if 50,000 is enough, but that's just my opinion, and it might take 100,000. So
yeah, and again, that would eat up a good portion of what we have. And so again, we wanted to allow some flexibility for your guys' input as to what things should look like moving forward. And again, a lot of these projects, a lot of these $35,000 projects, we just awarded in October. And even in the AT Bridge Assistive Technology, if there's challenges with any of these projects, they may need to be dropped off and we may need to reallocate those funds or determine something else to fit it. So again, there is some flexibility, or if there's a project that's doing really well, we may want to give them more money to continue. So
true.
again, there's flexibility here, but it's just to kind of give you an idea as to what we're thinking.
Okay.
Any other questions? And again, these targets, no, these still need to be determined. Everything for 27. So, you know, I think it's really a little too early to determine what will be carried forward. But oftentimes they want two work plans. Like Marcy said, they haven't determined whether or not they want 1 year or 2 years worth of work plan. So yeah, this may need to be figured out as well. So again, none of this is static. But so yeah.
Yeah. Okay.
Anyone else? Okay, thanks.
Thank
Hopefully
you.
that-
Thank you, Lonnie.
So,
Kathy,
will
I
we-
could,
I'm
if
sorry.
you want, Kathy, I'm sorry. If you want, if the committee wants, I could go over quickly the work plan as it is now and point out the new ones as we go through it. And then that will give you guys an idea. And then back to everyone to kind of figure out, we have about 100 grand, what ideas open for discussion. What ideas can we add for the work plan and where it would fit? So
Okay.
would that be helpful?
Yeah, that would
Yes,
be
it
helpful.
would.
That would be very helpful. Before we get started, we have just an hour left. And if we don't complete this today, do we still have time to have another meeting?
Yes.
Okay. All right.
Yes. Yeah. Okay. So if everyone could see, and if someone else can manage the scrolling, that would be great. So the first goal talks about meaningful change. And it's around leadership to policymakers, disability organizations, community stakeholders to sustain meaningful change in policies, practice, and systems. So it's a big arching statement. And what fell underneath this first objective, which is to pursue policy change, which so we think about systems change efforts here, affecting people with IDD and their families through engagement with policymakers and relevant stakeholders. We have 6 activities listed here that are all carryover projects. So if there's something else that as we go through this, as you're thinking, jot down your ideas, and then we could certainly consider adding it. So the first one, which I think has always been really important to the council, is the data hub that's currently on our website. We have a contract with Dr. Alex Kurz to do. It's down to $10,000 because he does just minimal updates on this. And we actually have a meeting with him this Friday to go over some stuff that he's going to be updating John and I on. And so right now we continue to receive the updates. He does that. And we do kind of need to figure out with him his expectation to continue to do the work and what that looks like. There's not the ability for our staff in-house to do it. And he really has the background to review the information that needs to be, plus get the information from DDD, which is established through an existing memorandum of understanding. So we're going to continue to still have discussions with him, but that's the first activity that's continuing on, and that's a small amount of money. If you scroll down to the next page, the second activity is the governor's workforce cabinet under Michael, who works with the current governor's workforce cabinet, which is disability related agencies and organizations, to conduct the employer forum and then to promote them the National Disability Employment Awareness Month. So that's a carryover that is important that fits nicely underneath this objective. The next activity is Employment First Initiative. Again, Michael is the lead on that, partner with Sonoran Center and agencies to support and promote Employment First. That project has been going on for quite some time. And so again, we're going to add it in here to continue the work as a systems change. The fourth activity is something that Jason has been working on fairly recently from 24 or 25. It's called the Arizona Transportation Innovation Fund. From what I know of this, it was legislation that was passed that allows $2 million to be used for transportation projects to non-governmental organizations. And per the legislation, an annual report must be released by the Treasury's office, because they handle the funds, where the funds were distributed. It's what Jason's role in this was. He was meeting with ADDPC and with the Treasury's office to ensure that these funds also address the lack of transportation in the rural communities, and especially for people with IDD when there's lots of barriers to transportation. And so he's still engaging with them on this, and hopefully you'll have more information for staff on when those funds were supposed to be obligated or liquidated and when the report was going to come out. Someone had a hand, John.
Yeah, thanks, Marcy. I just wanted to be clear, in case it isn't already clear, that those 2 projects that Michael is working on require no funding from the council. Those are staff-led projects, and it's just part of Michael's job responsibility. Similarly, this Arizona Transportation Innovation Fund is just something that Jason is working on as part of his portfolio of work. One thing to note about this is the money has not even been placed. This fund has not actually been created yet, so the state is still working on it. This is a public policy issue that is typically, as is typical of many of these things, is going to take some time to get put into place. And so Jason will update as time goes by, but there's nothing at this point to report on this.
Good to know. Yes.
Well,
And
can I-
again, my bad on not notifying that these were zero funds, allocated funds.
Okay, could I just say one thing about Jason's, is he active in, I'm not sure what the legislation says. Do they have to create rules for it, or, could we be part of that, at some point?
Yes. And actually, yeah, the legislation requires that a whole structure be put in place, rules, policies, means of utilizing the funding, means of applying for the funding. So Jason is part of those conversations. He's having ongoing discussions with folks in state government at ADOT, the folks who are responsible for putting this together. But as probably you know better than anybody, Kathy, this stuff, it moves at a
Slow.
glacial pace. Yeah.
It does. Thank you. Sorry, Marcy.
Sure.
No worries. I'm glad John jumped in and clarified anything here. The fifth one is something that John has been working on, very important for the council, which is the Bridging Aging and Disability Network. That has continued to still be in place, and it's a bunch of different folks that meet. It looks like 4 work groups established. The state team meets every other month. So John is the lead on that, takes no additional council funding. And we definitely want to carry over that activity to support a systems change as an activity to report to the feds. The next one is another one that John also participates with many partners. It's the Health Equity Project. And so that one, John, I'll let you talk about the last 2 projects.
Yeah, there's a lot of health equity work being done around the state of Arizona right now, and some of it is coordinated between organizations. Some of it is just separate efforts through the Rural Health Project at the University of Arizona, through this Health Equity Partnership of Arizona, which is a collaboration of the 3 state universities and Mayo Clinic, other things going on. But basically, my role is, in most cases, to make sure that the disability voice is represented in this work, and to make sure that people are cognizant of the particular and unique needs of people with disabilities as they address health equity issues, whether it's climate related or heat related impacts on people with disabilities, or more broadly social determinants of health, those kinds of things. So we work with state agencies, we work obviously with the universities, and we work with a lot of private agencies, nonprofit agencies, to ensure that these issues are being taken into account and addressed.
Melissa, you had your hand up?
I do. Just a little tiny nitpicky thing. There's a typo on here, and staff knows how crazy I am. Look at the page where at the very, very top, it says improving services and support for the 50 plus and elder populations. I'm assuming that means 50 plus. In box number 5. Yeah, right there. Do you see it?
No, I think we were talking about the 50 plus.
Plush?
I actually
Sweet.
like to be a plush, yeah.
Well, I'm 56, so then that's great, because I'm like, I'm not
We will-
liking. I don't.
We will
want
correct that.
Thank you.
Thank you, but it is a worthwhile project. Plus, a
Yes.
plush, whatever. Thank you.
Yeah.
Okay, thank you, John. Marcy?
Okay, so that's the first one. So if you have ideas that you think should be added on to this, new projects for that $100,000 to spend down, jot them down, and then we could come back to it. So I think we'll try to get through everything here, and then I think it might be easier to go back where we think new projects might fit. So objective 2 under the first goal, council will lead efforts at individual, community, and system levels to advance safety improvements while preserving individual rights, autonomy, and dignity at risk. We have 2 new projects that staff came up with. And the first one, again, these are just ideas. We don't have any more information about what the statement is, what the output, outcome, or performance measures are. So we need to kind of flush this through here in the next couple of weeks. But Jason is been really interested in working on the criminal justice system, and there's the potential for a pilot regarding clemency law clinics. We just we're going to temporarily allocate 35,000, potentially as a direct contract to ASU, the justice, what he refers to as the Justice Project College of Law. And he is, my understanding is he is learning more about this, preparing an outline, and wants to include this as something that's perhaps the council to support. But we do need a lot more information on it before we can receive a proposal from ASU. John.
Yeah, I just wanted to add a little bit of context. Jason and I have had a couple of conversations with some folks at the Arizona Executive Clemency Board around this. As you know, Jason's been doing a lot of work on criminal justice over the last couple of years, issued a criminal justice report about a year and a half ago. And we learned fairly recently that prisoners who are applying for executive clemency, many of whom have an intellectual or developmental disability, often have no guidance when it comes to filling out the forms, when it comes to actually petitioning for clemency. And so often they make mistakes and they invalidate their application, and they can't get any public defender support because it's considered out of the purview of the public defenders. So basically they're on their own. What we are proposing, generally speaking, is to provide some funding so that attorneys could be made available to help prisoners fill out their clemency application and not necessarily be represented when they come before the clemency board, but at least be able to get their paperwork in order so that they at least have a level playing field when it comes to applying for that. So that's really kind of the gist of what this project would entail. There are more nuances than that, and I would have to let Jason really explain that, but that's kind of where we've been having discussions lately. And we've been talking with staff from the Clemency Board. We've been talking with staff from a couple of private prisoner advocacy organizations, as well as some folks from ASU Law School. So just to give you a little more perspective on that.
John, can you talk about number 2?
Yeah. This is a challenging one because I think, as everyone knows, we as staff have been frustrated by the current project we're funding around sexual violence against the IDD community. We have some real misgivings about the project that we're funding through the University of Arizona, through the Sonoran Center. And at the same time, we recognize that this is a really significant issue, and it's one that the council has invested a lot of time and money and effort in over the last several years. We don't necessarily want to just see it go away. We don't necessarily want to just drop this as a topic that the council supports. At the moment, though, we are a little bit challenged when it comes to where we go with this, and if we go anywhere with this. So the issue hasn't gone away. We all know that. The question is, where can the council play a role so that it actually makes a difference, actually makes an impact moving forward, and how can we find the right partners to support, to fund, so that the work they do makes some progress on this issue. And so you can see there's a lot of white space there. There isn't a whole lot filled in as to what we're thinking of, where we're going. We would be very open to ideas from the committee on this. It's just we're really struggling with whether we continue to support something in this area or whether we take a break from it. And if we do, will it cause the momentum to lag, or all of those considerations? It's just a challenging one for us right now.
I feel like we can't let it go, but on the other hand, do we really understand other people's perspectives on this, and maybe having a discussion with other groups to understand, like we want to improve or conduct training and distribute materials, but is that the key thing, or is it another area that the community feels we should be more involved in? I don't know. I just, maybe we just don't have enough information right now to know where to go, if we want to keep this topic alive. My first gut instinct is to just say we need to do more awareness campaigns on the media, but then, that sometimes doesn't take us anywhere. But I also feel that, when I've worked with ASU and their sexual violence and trafficking committee, there was just so much information there that maybe we should have a discussion with the people really in the field, working with the people, to see if there's some other place we ought to devote our attention and funds to. But it's just a thought. I don't know.
Yeah, well, certainly one of the biggest challenges for this is the number of different players involved, the lack of coordination between state and private systems that are geared to address the issue. And I think you're right, Kathy. We may just not know what we need to know. The Arc of Arizona, the Arizona Coalition to End Sexual and Domestic Violence, they continue to do work on this. Some folks from U of A, some folks from IHD. There are a lot of people involved and a lot of people who have an interest in making a difference here, but there is such a lack of coordination. And when it comes to it, really only state agencies and law enforcement agencies have the kind of resources that it will take to push this forward, to prosecute more people, to prevent more of this type of thing taking place. We could do a media push, but I don't know that we have the resources to do it justice. So,
yeah. And even if we
it's a matter, how do you get the prosecutions and the arrests and everything? I don't know. Interesting. Right. Yeah. I thought I saw Bianca's hand go up. Bianca, did you have something?
I did, John. And I think, you kind of answered the question for me, in terms of what's been the sticking point with this project. Because, I know that there was, that report that was very powerful that, was produced. Then I think, like Kathy said, trying to figure out what is the biggest impact that we can have, or how can we go about doing this when there's also other groups and things like that have focused on sexual violence. And maybe it is just a matter of working with some of those groups to help expand their awareness and knowledge and so that they can include sexual violence against individuals with developmental disabilities and intellectual disabilities, so that they're aware of that and they can use their resources to kind of increase the broader awareness of that. But I do think that it sounds like it's certainly it needs to involve a little bit more conversation about how to move forward with this project, is from what I'm understanding.
And you guys aren't satisfied with what's happened so far. So I think we should step back and take a look at this again. And,
So sorry, Melissa.
No, I would just say that it sounds like we need more information, because I know we haven't been happy. I know they didn't make any progress with legislation, with policy, with anything. And I think maybe taking a look at what's been accomplished, what we'd like to see done, and what's happening, and who the major players are, to maybe just kind of look at the whole thing and kind of regroup.
yeah,
We need more information.
yeah.
I agree.
I mean,
So
I
then
really understand legislation. It's difficult to get legislation through, but I don't know. Maybe there's other things to focus on.
Well, and there are even efforts this year. Matt Gress introduced a bill to do a school sexual abuse prevention program in public schools around the state. That is struggling just to get through the legislature right now. It may in fact be dead. There are, every time legislation is proposed, it runs into walls. I guess I'm wondering from the committee members' perspective, would you suggest that we not plan to fund something in this area for the coming year, and we use the time to kind of regroup, get engaged with some of our potential partners and really try to understand the issue better and then come back at it in 28? Or would you recommend maybe that we allocate some level of funding in the event that we come up with something that we looks promising? But I guess when I say that, I want to emphasize, and those of you who were on the call with Rebecca Hines a few weeks ago, you know that from ACL's perspective, what they're looking for is impact. They want the projects that councils fund or the projects that councils undertake to be able to demonstrate impact. And right now, as I look at the project we're funding, I cannot tell you with any confidence that it's going to have impact. So that needs to be part of our thinking, whichever direction we go.
Yeah, I liked your first suggestion. I think we need to step back. I don't know what the rest of the group thinks, but I think we need to just reevaluate. And then maybe in the next year we can fund something. Melissa?
I would agree that we need to step back right now. I don't think that, because we don't have any clear definition of what we want to do, I don't think continuing to throw money at this without some really clear goals and objectives is helpful. I mean, it's tremendously important, but there's no point in spending or allocating a bunch of money for it if we don't even know what we're aiming for and who's going to do it and how it's going to get done and all the reasons I'm going to say. So
Yeah.
that's I'm on the same page as you, Kathy.
Yeah. Monica, what is your thoughts?
I agree. I think, I'm not saying we should give it up totally, but like for right now, what about allocating funds, for something else? And then when it comes up again, maybe, or I'm not sure. I mean, in some ways, I think if we just take a step back on it.
Bianca, what's your thoughts?
I agree. I think we need to be strategic about this project, and if it's not having the impact that we were expecting it to, then we should regroup.
Yeah, I think so. Okay.
Yeah.
All right.
Okay.
So I think our group is in consensus that maybe we should step back and regroup on this one.
Can I just ask a question and clarify? Do you want this activity to have statements underneath it that staff will, that we're going to report to the feds that staff is going to review previous work, or do you want this completely removed in 2027?
Well, I think staff should rework it. I think we just need more research done. Would ACL be okay with that, or do you think they would not like it in here at all? I'm not sure.
Yeah, I don't know that we're going to get
Pushback?
I don't know, Marcy. Yeah, I don't know that we're going to get pushback necessarily if there's no funding attached to it. If we're just showing that we are that we're doing
Evaluating
further
it better.
exploration, then
Yeah.
I don't see any harm in that. At the same time, I'm not sure that it needs to be. I don't know. I'm going to open that to the rest of the staff. Do you think we need to have an actual activity?
As long as we don't lose it.
Maybe
Sorry.
we
Right.
could
No.
Lonnie?
have it as an internal note, maybe something that isn't reported to ACL, but something that we track internally. So that way, highlight that activity for internal purposes. So we're keeping it, but not necessarily report ACL wise. Does that make sense?
Yeah. Then do you do that with other projects where you have it not on the paper, but in the background, you're doing more research, more evaluation to see if it could become a potential project?
Yeah, I don't know that we've done that, but I think it's something that could be done. Just a suggestion.
Okay. So, it sounds like, and Monica, Bianca and Melissa, tell me if your thoughts are that we will let it be taken, we would like to suggest it be taken off of this document, but somehow housed someplace else so it stays as a project that they still work on. Maybe it's just in the research phase again, or evaluation phase.
I agree with that, with keeping it internal. Yeah.
Yeah.
What'd Sarah say? Yep. Okay.
Sarah? Okay, Sarah says we won't drop it fully. Okay.
Right. I think what we'll do is keep monitoring who is doing what on this issue statewide. So whether that's our partners at ACES DV, whether that's local, police departments or county attorney agencies, but it might be harmful to keep it in our plan and have ACL say, oh, there's no outcomes. You need to take it off in the future.
Yeah.
And then we can add it when we are more confident about how we can contribute in an official way. But every single staff member is passionate about this issue. So there's no way we're going to ignore it, right?
Yeah.
Probably how we can contribute best at this moment.
Yeah.
Yeah.
I think the political climate and just things that are happening at the legislature just, makes it really difficult right now. So, yeah. Okay. Are you guys okay with that, John, Marcy?
Yes,
Okay.
Thank you all.
yes, thank you. Okay, continuing on, just a few more out of this objective 2, mindful of the time here too. We are going to keep for a recommend third year funding for NAU's online privacy and safety training program. We had a meeting recently with Kelly Roberts and John McDermott and asked them, they're doing really well in their second year. They've got 3 different age groups for online safety of apps, usage of your phone, your tablet, the computer, to make sure that people with IDD stay safe and they know how to be safe when they're using electronics. Family members, parents, caregivers participate in some of these trainings and provide feedback, and they're continuing to update their materials. They are posting this materials and trainings online, as well as providing in-person or virtual trainings to different groups. They've had good success on that. And going in for third year, what they want to do is, and let me just sign in here. They want to do a couple things to kind of make it more sustainable. Is they want to develop and implement an evaluation plan to assess the longer terms of ops. They want to continue to deliver age-appropriate ops training to the age groups of now 5 to 12, 13 to 17, and 18 and over with IDD. Provide conversation tools to help families discuss the digital risk, and launch family learning circles and virtual discussions for family members and caregivers. They also want to introduce practical guidance related to online relationship scams, employment, and privacy for anyone, and then provide a step-by-step technology guide for real-world digital use. They're going to also propose scenario-based learning, videos, and interactive activities. So they're moving forward on different ways to still enhance this, but be more thoughtful about creating videos, creating guides for family members, and then to do more evaluation that's more long-term. So that's what they would propose coming in for a third year. So we really feel this has been a really good program. The numbers you see, I don't even have the numbers listed on the left, but they would be developed based on the third year of that. So we look at both numbers of people trained, self-advocates participating, family members participating, and then we would look at any other systems change or performance measures to be part of that. And it would be level funding.
Okay, so the level funding means that 72,000 in year 3 would go towards their ideas, right?
Correct.
Okay, okay.
And
Yeah.
then if they, yeah, and then once they come in with a proposal, the outcome statements get updated to reflect that. And then we start discussing what the performance measures are. So everything gets updated in that sense.
Okay.
And this
Yeah.
contract, just so you know, runs through the end of June, year 2. So any proposed project that we're going to continue for these contracts that end in June, we're going to start sending out information to them about the renewal packet pretty soon, within the next week and a half. So they
Okay.
have to submit and for the staff to review and council to vote on.
The only thing I was hoping we would maybe do with the scams is that somehow put in our older population too in that, make sure that we're able to give that information to the older population for scams that are coming up, things like that.
Sure, I think that's a great idea. And you know what, I'll ask John if he is getting any feedback from older folks participating or how to do further outreach.
Okay.
We really do get targeted a lot, all the time. And it's terrible, 50 plus, not plus, to be targeted, to be outreached. I'll reach out to John McDermott on that. I'm sure he would have great ideas about that.
Okay, thank you.
You bet. Thank you for that. Okay, moving on. The next one, communicating safety issues to DDD. This is a project John has been doing for several years. John, do you want to speak about this one?
Sure. This is, to be honest, this is more of a passive effort as information comes to us, or as we learn things through the sexual violence work that various people are doing. We make sure that we share that out to the community. We do it through our newsletters. We do it through social media, through a variety of different forms. If DDD comes out with new policies, we make sure we communicate those as well. We're just trying to make sure that people are aware of the latest developments to ensure that they are safe and that they know where the resources are that they can turn to in the event they feel unsafe. That's about it.
All right, thank you. And then the last activity here, this is another one of Jason's. Based off his report, it's we kept everything the same other than the output and outcome 2, which should be updated. It's to identify and support at least one policy change to promote the safety of people with IDD in the criminal justice system. This is something new that he is working on and proposing. I don't know if there's going to be funding for this down the road, but this is one thing that he's looking at is to, and I'm not quite sure who he's all working with on this right now, but it's really to develop a screening tool to ensure that it's ADA compliant, that people with individual developmental disabilities, that make sure that their ADA rights and accommodations can be met if they're serving time in one of a jail or prison in Arizona. And currently we know that there's not a screening tool for people with IDD in the system. And so we don't know, what sort of accommodations are being made, about their medication, their physical and well-being, their, what they should be having and why their time, is during pre-conviction process. And so he's been meeting with different folks on this. And one of the things he's been doing too is also calling law enforcement agencies to understand what their screening tools and policies are, because the jails are obviously with the sheriff's office per county, and then trying to understand, what may be in place so that he knows with the work group how they should proceed. So this is going to be a long-term project, but it's something that's very important as a way to be try to again, being involved in this issue has been really important for him.
I like this one. It is a long project.
Yeah.
Okay.
Okay, so that takes us, any other thoughts before we move on to goal 2? Anything that we should add?
to either objective, $100,000, going once, going twice. Not yet. Okay. You could always email us. Okay. So then we are going to move on to objective 2, page 5. I got that. No, sorry. My bad. Objective 1, goal 2, page 8. Oh, God. Okay. There's only one project listed under the objective, and this is around the shifting perceptions goal. The council will work to shift perceptions and practices so that more professionals engage effectively with people with IDD, and 2, more individuals with IDD and their families presume competence to pursue opportunities comparable to their peers without disabilities. And the first objective is the council will support training designed or co-designed by self-advocates for professionals on how to engage with people with IDD across different settings. And so we put in there as examples, healthcare professionals, law enforcement personnel, financial advisors, caregivers, and support professionals. And we need another, we need to close that. So we need ideas about what would fall underneath here. What we're going to do is just continue one project, which is the Sonoran Center's Direct Employment Services Professional Initiative that is currently funded. The contract began late because it was signed late. It was a direct ISA with U of A. So it ends this September. And any of these new ISAs that started late last year after October that the council approved, they all had different sign when they were signed off, but we are planning to continue them. So if you see 35,000, you see the contract period, we're going to have discussions with U of A about what a second year fund look like. So we are keeping this project, and it is something that Michael's committee was helpful in putting this forward, and I'll leave it to Michael to explain it further.
Thank you, Marcy. Yes, this was the project in collaboration with the Sonoran Center and the Arizona ADDPC chapter. Last year, we conducted a survey and we received really good responses from people who are on the ground providing employment services about what kind of training they needed, what kind of assistance they needed, and then whether or not if they received a certification, that helped them improve the employment outcomes. The good thing about this project is that the council agreed to support it. And one of the first components of this is for employment service providers to take an exam that's offered through ADDPC. It's the Certified Employment Specialist Professional Exam. And so our goal was to have between 5 and 10 people obtain this certification. They have 8 people that have signed up. So we're gonna, and then 2 more are interested. I spoke to Hope Levy, who was mentored by Melissa at the Hope Group. She said that people from her organization want to take it. So we're really excited about this because we feel that, again, training is always essential. It's needed. And we need to find out what best practices are out there to help these individuals achieve competitive integrated employment. So in addition to that certification, there are going to be training modules that were asked for, and we're very confident that the Sonoran Center, through Gina Griffiths, Jessica Winchester, are going to be able to deliver on this. And so we're looking at the continuation of this project. So that's pretty high level, but if you have more, if you have questions, I'll be happy to answer them. I did find one item that needs to be corrected, and it's just below, just like Melissa, she's able to find everything. In the performance measures, the 3rd column over, 4th column actually, where it says outcome statement, it should be direct employment service professionals, not director. So I'll make that correction.
Yeah, the change on that, if you can.
Sure, I'll be happy to do that.
Okay, thank you. We don't have any activities listed here. So thoughts about what else can fall underneath here?
I thought Mike kind of listed the activities of what Sonoran is going to do. Is that okay, or do you want activities that council staff are going to do?
It could be either, Kathy. It could be, we've got 100,000 we have to use either entirely or broken up with new activities. It could be in-house activities to support this objective and goal.
Yeah, I was thinking that 35,000 doesn't seem enough, but I think at some point, if we could get enough people to take the CESP exam, that we work with the agencies to put it in their contract requirements that people have the CESP certification. But I don't think I think that's, something that we should work towards, of kind of informing the agencies the importance of the CESP certification in working with people with disabilities, I don't know if that takes more money, but I do think it's something we should do to make the contract officers in the different programs aware of this requirement or this certification.
Hey, Kathy, I do have a comment on that, if I can.
Mm-hmm.
Mike and I had talked a lot about this, and one of the things that I had wanted, I want data, because, and I had talked to the people at ICI, had been in touch with them over there, and there is no data for any proof that's showing that any type of certification changes the outcomes. There are no longitudinal studies.
Oh, darn.
And so my big thing is, because I'm not certified, right? I know a lot of people that aren't certified. I'm not opposed to it. I just look at curriculum and I'm like, what new thing am I going to learn? Like, they're really, unless it's somebody really, really, really good, like at Mark Gold and Associates or something, I'm like, that sounds terrible. Maybe I'm 100% wrong on that. And I think that's kind of an attitude. The cost of that exam is $200, and it is the cheapest one to take. So for vendors to make that mandatory for all of their staff, like, you run into that, like Kristen Mackey and I have kind of talked about this a little bit about, and they tried to mandate this in other states. So I've been really interested in Sonoran, you said, with this. I'm like, I want data. Nobody has done this on what are the outcomes for coaches, employment support professionals. How's that going with their clients before they're certified? And then with those same coaches, is there a rise in their placement and their retention? Like, what happens? We don't know that. So,
well, are you suggesting that maybe we use some funding to gather the data and evaluate it?
I think it would be helpful. I don't know if that's doable with Sonoran, you said. And then my question for Mike is, how are they doing with coming up with trainings to put out to the public? Do you know how they're doing with any training modules, Mike?
So the first phase, Melissa, was the CESP exam to get the word out, to market it, promote it, to get people to commit. And so now they're focusing on the training.
Okay.
There was one disappointment that we had that we found out just recently. The state applied for the NEON grant through ACL and the Office of Disability Employment. And they being the Sonoran Center, they put together a really good proposal. They obtained support from a lot of organizations. And we just found out last week that Arizona is not selected.
Oh.
So the reason why I'm mentioning this is because they were going to use some of that information gleaned from that NEON project to see if they could enhance some of the training modules. But I guess this is a long answer to your question, but now they're going to focus on the training modules rather.
Do they need more funding for that training modules if we're looking to spend money?
Well, we committed 35,000, so I don't know if we could supplement that, but maybe as the continuation, to obtain the data. I think that that's really important. Maybe we could fund that. And if we find that there's a gap or there are other service training modules that are required, then perhaps that could be funded.
Yeah, if we could do that, and, I've talked about evidence-based, programs. If we could make this evidence-based, based on the evaluation of the data, that would be really nice.
It'd be a
Okay.
first.
Yeah, it would.
Be
But
a first nationally. Yeah. Okay.
Bianca?
I wanted to just mention something else, Kathy and Melissa. The good thing about this project, the beauty of this project, is it's a partnership, it's a collaboration, it's the Sonoran Center, it's the Arizona APSI chapter. We're also working with the Colorado Office of Employment First. So that's the first Employment First office in the United States. And so they're doing a lot of great work. And so we're able to obtain information from them. They're providing technical assistance. So we have that really good partnership with them. So we'll have a discussion with them on what other service, that question that Melissa raised about what other training is needed. They might offer some suggestions on how we pursue that.
Thank you, Mike. They're a great resource and we should use them.
Yeah.
I'm sorry, Bianca, I interrupted you.
No, you're fine. No worries. I was just thinking in this discussion, one thing that might be helpful with Melissa, I know you mentioned, what is you trying to collect data and evidence that having, taking the CESP is actually making meaningful changes and is genuinely helpful to folks who are, going through this program. I think it might be helpful to do kind of a pre and post test to kind of gain some of that evidence and that data to see, okay, what are folks coming in with? What's their base level of knowledge? And then comparing that to, how they do not only on the exam, but even on, just another, separate test that, or just like an internal test that the Sonoran you said could, or the Sonoran Center could potentially just, deploy just to see, okay, what is the data showing? What are we seeing with our program? Another, and this is kind of a little nitpick, but because I'm not as savvy in this area, would it be possible to include the full name of the CESP exam and then have that in parentheses? Just because there might also be other folks that are not familiar with what the acronym stands for. I'm assuming that ESP is Employment Services Professional, but the C could stand for a few things. And so
That's
a good idea. Yeah.
Good idea.
I agree. Any way that it can be made into plain language would be helpful.
Okay. Thank you, Monica. Thank you. Yeah.
Yes.
Okay, so Marcy, does it seem kind of clear as to what our suggestions are? Or
So if I understand correctly, you want to set aside some funding for a research on whether there's any impact.
Yeah.
You
is
know,
it going to
people,
become an evidence-based program?
so and do you want specifically U of A to do this, or do you,
Melissa?
or, I mean, is this something that needs a competitive bid for someone to come in to do this?
Oh man, that's also a Mike question. The Sonoran you said has obviously been very involved in this area. And I would say they probably know more about it than the other universities. Mike, what are your thoughts?
Is this a national, is there other states doing this where this is a national data collection?
Nobody has gathered data in this area. I had talked to Jean Windsor and she said there have been no studies on the befores and after results of the impact of anybody being certified. Nobody's done it.
And we don't know how many states have been doing this?
There was a presentation at our last APSI conference that did talk about the certification, and I think I still have that. Mike might too. I don't know if you sat in on that presentation. The pros and cons, the road bumps they've run into, and that's kind of the most data that there's been on it.
Okay. We could flush some of the details out with staff to figure out what would be the dollar amount, whether this would be competitively bid or whether this would be something that we would, if U of A would do it as a direct contract. I don't know if that's has any sort of conflict of interest since they're doing a program and then, you know, kind of stepping back and doing an evaluation, but to see if, and maybe there's a conversation that Michael could have with Gene Windsor about it, to get more of a national perspective so that the scope of work is written correctly.
Yeah. Mike, what do you think?
Well, I have some mixed emotions. I think it's difficult for an organization to evaluate itself. As much as I really support everything the Sonoran Center is doing, I really think that ICI, the Institute for Community Inclusion at the University of Massachusetts, Boston, through Gene Windsor, they do incredible work. I know, Melissa, you did reach out to Gene to ask her, and I think this is something that she would love to delve into. So
She's qualified more than anybody.
she's
That's for
very
sure.
qualified. So I'd like to explore it and you know, see what information I can gather, and I'll share it with our committee.
Sounds good to me.
Lonnie, you have your hand raised?
Correct me if I'm wrong, but I remember in reading this proposal that part of what we wanted was to get that baseline information because we knew the data didn't exist. So I thought part of what they're supposed to be doing this year is gathering baseline data so that way we know whether or not these certifications are leading into better employment outcomes. So it's my understanding that this evaluation piece should be going on as part of what they're doing this year. Getting that, because again, nobody really has these certifications yet. So it's just like, okay, get the certifications, get the baseline. So that way you could determine once you've got those certifications, is it making a difference? So it was my understanding that this should be part of what they're actually tracking this year.
Lonnie,
I'm
Lonnie,
wrong.
you are correct. They are gathering baseline information. However, it will take a while once the individual obtains a CESP and then starts applying it, how
Yeah, it's going to take
effective
a while.
it is, and whether it is leading to increased employment outcomes. My thinking is it will, but I think it's too soon to be able to have that information. It's going to take a while to be able to gather it.
So what if we make a note somewhere that reminds us next year to look at this, that could we add this evaluation component from ICE or whoever the organization you talked about of evaluating it down the road, you know, so. In year one, we do this, year two, we do this, or we do year 1 and 2 with Sonoran Center, and then year 3, we add this other agency to evaluate the whole CESP evidence base, see if it's worth it. What do you think of that?
I think that's a good suggestion, Kathy.
I agree.
Okay.
No,
Marcy?
I think it's good. I just wanted to say.
I'm
I
glad
think
you
we're
brought that
doing-
up. Yeah.
I think that baseline should be happening this year, so that way we do have a starting point for it. But no, I think notating that, you know, ensuring that that baseline is being captured this year and the next steps for ensuring that we have the data that we need to move forward would be helpful.
Yeah. Yeah, I agree.
Yes, I have enough information. Thank you.
Okay. All right.
I agree with all of this.
Yay. Good. All right, Marcy. We got 9 minutes more.
Okay, it won't be long. Okay, objective 2 under the second goal. Michael has been working with U of A to work on a site for project search expansion. We have funds already designated for that. And we just need to work out the final details with the Sonoran Center about who it will be so that we could get a contract in place. And it's $18,000 for the licensing fee that the council will pay for it. So 26 has more details, but it will start, if we could get the contract in place by October 1, we'll pay the licensing fee, and then the Sonoran Youth Center will work with the designated project site in the upcoming year. So obviously has to be continued on. Moving ahead, ABLE DB 101 training. We're going to work on kind of revising this language if we need to. I kind of proposed different ideas to Michael about it a couple of weeks ago, but as it is, and as it stands right now in the current work plan, we work with PES on ABLE training, but we need to do more, and we need to be out there in the community more, and tribal communities, family members, other areas. And so, it really is something that's important to do, but it's more of getting out there on a regular basis and just once or twice a year, and working on the materials, make sure they're updated, and making sure that there's a presence of information going out. So we feel like it's important to continue on. It does not take any funding from the budget. I will pass this over. The third one is a new project listed, which is for Think College Arizona Technical Assistance Center to Michael. We have designated $100,000 for new funding, potentially to ASU. So Michael, you could take that.
Thanks, Marcy. So we've made considerable progress in creating an Arizona Think College Alliance. We have NAU through the Supporting Inclusive Practices program, Grand Canyon Lopes Academy. ASU is going to develop a new program, and of course, project focused down at the U of A, which is more high school based. But the fact that we've come together, we've formed a group, we've had meetings. We just had an annual meeting a couple of weeks ago. And the new commissioner, Rebecca Hines, John was able to invite her. She attended the meeting. I think she was impressed. Unfortunately, I wasn't at the meeting, but from what I heard, it was really good feedback. What we'd like to do now is move forward and create a technical assistance center so that we can have a full-fledged organization focus on promoting inclusive practices, inclusive college. And so we've been talking to ASU about them submitting a proposal. So we're at that beginning phase right now with that.
So this is like year one.
Yes.
And then year two, you hope a proposal will get submitted, right? Is that?
Well, it would be a proposal for the new fiscal year, which is 27, but it would be a proposal to establish a technical assistance center, and then with the plan for it to be sustainable. So that would have to be part of the proposal.
Okay. Okay. I like that. Okay. Any questions from anybody else? Okay, moving on.
Okay, and then the last project may have a difficulty moving ahead if we don't see some changes with the program. We're funding NAU IHD for AT Bridge. It's an assistive technology program meant for 11th and 12th graders only, initially and only focus on Yavapai and Coconino County and rural areas and with tribal communities for high school students and students with IDD. And it was really to engage them in what assistive technology is, how they could access it, how it could be individualized for them for post-secondary, life and education, and for them to use, and really for their families to be supportive of. They did outreach to 26 different schools already and had no interest. No one really was interested in partnering, or they, 2 schools did additional outreach to say, I want more information, but they never reached back and called NAU on follow-up. So we had a meeting with them. They are going to open this up to statewide, and they are looking to get the word out. So Sarah is going to work with John McDermott to get a summary of the project out, posted in our newsletter. Hopefully Encircle Families will do the same to get the word out for families to hear about it and say, I guess my student will benefit from this if we can have it in their IEP and work with their special ed teacher. So it's really just to kind of continue some of the other assistive technology projects that we funded in the past. But if they don't get the numbers that we think that they should be at by the second and third quarter, it is something that we will talk about with staff and bring back to you guys that we will not continue this funding, unfortunately, because again, it's one of those things that if you're having difficulty and we're trying to address all the barriers, what will a second year look like? So it's something that we'll think about with NAU and Kelly and with John to continue to make sure, they could at least get 8 students, 2 high schools, 3 high schools, 4 high schools around, at least a minimum number, and we'll see where they're at with that. So I appreciate Sarah and her outreach to trying to get the word out, and we'll continue to monitor this project closely. But we listed it here in case it happens to succeed. That is it for this second goal. And there's only a few activities under the third goal because the second objective is actually the third objective is the emergency preparedness. So in 2 minutes, let me at least try to cover objective 1 if I can under the third goal. It's community inclusion. Again, we've always had inclusion, but we feel it encompasses a lot of different areas. To expand opportunities for community inclusion so that people with IDD and their families experience a greater sense of belonging, meaningful participation, and community connection. What falls under the first objective is the self-advocacy mandates. So this would be continued funding for the ARC of Arizona, level funding at $60,000. We are discussing ideas for going forward in the 4th year. So I can send out a renewal package to them in about a week and a half. And we want to make sure that they at least continue to work with 25 self-advocates and continue to do leadership development and making sure that the participants have an opportunity to participate in leadership development training, can conduct peer-to-peer training, as well as participate in community boards or task force in their own community, which is also a mandate. John.
Thanks, Marcy. I just wanted to throw into the mix here that I've had some preliminary conversations with Melanie Mills, who's the executive director of the ARC of Arizona, related to potentially expanding the scope of this particular project. And one of the things that we keep hearing from ACL is they want our self-advocacy work to have much more of a peer mentoring and leadership development component. So one of the thoughts that we've had, or one of the thoughts that I've had anyway, is potentially including some other organizations along with the ARC of Arizona, organizations that maybe have more experience with the peer mentoring, such as Diversibility Incorporated, to build in an additional component that really focuses on that peer-to-peer interaction that will lead to leadership development, because that's another strength that Diversibility Incorporated has. We have not, none of this is carved in stone yet, but what I'm throwing out for consideration is that we potentially grow the scope of the project, put some additional funding into the pot for it, and really try to make some better inroads into that leadership development area. You can see we've allocated level funding for it for next year, but I'm kind of hoping for people's thoughts on whether we might grow it and build those other components in.
I like that you're reaching out to Diversibility. I really, really do. They've done such a good job with peer mentoring and other things. So I'm like, it's definitely worth exploring. Susan over there is amazing. Of course, Susan Broyle, we all know. Just my thoughts. Just me.
I agree. I think what you're suggesting is good. I have the landscapers here they're blowing machines, and it's so loud I can barely hear. Sorry if you hear it. I do think we should expand how you're right. The peer mentoring would be great. And what popped in my head is, you know, how you go through school and then you go and you might get an internship or a residency or whatever. And I think, could we kind of do something like that in the peer mentoring program, that it's just established and we find places for these individuals to go, and they have to go for, I don't know, a week, 2 weeks, or maybe longer, and explore that kind of, how do you make their peer mentoring really meaningful? And you get these commitments from these people, we'll call them preceptors, to go in and do the peer mentoring. It's just an idea. Monica,
Yeah,
you have any thoughts or
not
questions?
right now.
Okay. Bianca, any thoughts?
I think that's super, Kathy. I think with your suggestions, I think that would make it even better.
Okay. All right.
And Kathy, sorry,
Agreed.
Kathy, I don't know if you knew it. Megan jumped on the call just a few minutes after we started, so she's here with us.
Oh, I'm sorry. I can't see it. Okay. I'm so sorry, Megan. I didn't mean to ignore you at all.
Don't worry.
Do you have any thoughts about the whole?
No, I thought everything's good. No, I'm paying attention. I would join late. I apologize.
No, that's okay. I am sorry that I didn't see your name pop up. So I apologize. Okay, Marcy and John, what are the next steps? What do you need us to do?
Well, we need to go back and flush out language, especially under the new projects. Some of the language for existing projects that we discussed, update what we've been able to go through today. And then we didn't get a chance to go through everything else. I'm not sure if there's just a new project listed under objective 2, which is something that we don't have any more information on, but healthy lifestyle pilot project and around 50K, but I don't have any ideas about what that scope of work would look like, and we need to flesh that out. I think it would be helpful if we bring this back to the committee, is that we flush this out, that are blank spaces, and we have more information in there about what that scope of work would look like, what the output or outcome would look like. And we can review, you know, go back and review some of that, and then anything else coming out of, you know, that we missed, or that you have more information on it that you would want to discuss. Again, this is just a draft, and the good thing is this doesn't have to go in until August 15th. So we still have time to work on it.
Okay. John?
Yeah, there is one other thing that I wanted to kind of bring to people's attention and potentially consider for council support. And before any of the staff members have a heart attack, because this involves research, which, you know, we've had a mixed history with. The state of New York and the New York Provider Network recently did a study around the economic impact of the DD service system in New York. And this caught my attention because one of the things we don't have here in Arizona is any good information that we can share with legislators or other policymakers about why, from an economic perspective, disability services and disability employment matter to the state. I mean, we have the report that we did, but it's a few years old, around employment. I would like to throw up for consideration, and we can, you know, talk about this further down the road, but the council supporting or helping to support a study that can really encompass the entire system, the provider system, the state system, and all of the ancillary impacts of DD services in the state, so that we have something that puts some hard numbers to why this system matters to the economy of Arizona. And we can take that to our legislators, and we can utilize that to reinforce the need for ongoing support of the system. I will tell you that I've already had conversations with APAD, and I've had conversations with DDD. They are wholly in support of this and would be interested in participating potentially as co-funders of something like this. So the financial burden wouldn't necessarily fall entirely on the council, and everybody's got ideas about how this could be used for the benefit of the DD community. So I have a copy of the report from New York, which I'm going to send out to everybody on the committee. It's rather lengthy. It's 52 pages long. So, not expecting everybody to read everything, but you might find it interesting. I think there are some improvements we could make over the report that they did, but I at least want to get our thinking on this, get our thinking going on this. If we end up not doing it, I totally understand if it's not a priority right now, but I do think, especially given the status of federal funding for the state and all the questions around our state legislators and their desire to make cuts to the system, this is a way for us to push back a little bit and show them why it matters and how big a financial impact DD services have on the overall economic health of the state. So anyway, I'll leave it at that, but I'll send this out to you for everybody. And next time we meet, maybe we can have a further conversation about this.
I like that. I really do like that. I think it's time we did it. Good. Okay, any other questions before we schedule our next meeting? So we could either meet in April or May. Marcy and John, do you need till May to kind of work on this and get it so we...
I personally think so, just because John's going to be out of the office, traveling the next 2 weeks, and I think we just need time to kind of flesh out a lot of language here. Jason's not in the office either.
Okay.
It's just a matter, and it's also just helpful too.
Yeah. All right.
Do late April. I'm okay with late April, but not early April.
Or May, right? Okay. So our next full council meeting is June 26th. And so we want to make sure we give you enough time to make any changes and we get it approved before the next council meeting. So anybody have suggestions on, are there any dates in May that are not good for you, like on a Thursday or Thursday? Because there's April 30th or May 7th, the 14th or the 21st or 28th. Any thoughts from everybody? Any conflicts?
Okay, Kathy, what days are you looking at? May,
the Thursdays, like May 7th or the 14th, the 21st. Probably not the 28th, but that's probably getting into more vacations.
I think I'm okay for now. I can make no promises as my appointments go.
Yeah.
For now.
Same
those are-
here. Yeah.
Okay.
If I could recommend.
Uh-huh.
Sorry.
No, go ahead, Tom.
From staff perspective, just looking at some stuff that I have on my calendar and a few others, the 7th or the 14th would probably be better, as best I can tell right now.
Okay.
But others can chime in if that isn't correct.
Okay. Is everybody okay with May 7th?
Yeah.
Okay.
Yes.
Yes. Okay. So what if we do May 7th? And was 11 o'clock okay, or do you want to do it earlier? Like 9?
I could do 9. I have an 11 o'clock I have to be on.
Okay. Everybody okay with May 7th at 9 a.m.?
Yeah. I'm fine with it.
Okay. And we'll do an hour and a half. Do we need an hour and a half, you guys? Probably just to go over things again? Yeah. Okay. All right. So we'll do the work plan review committee on Thursday, May 7th at 9 a.m. from 9 to 10:30. Is that okay with
Okay.
everybody?
Thank you.
All right. Thank you.
Okay.
So close meeting off. Thank you, everybody. And I appreciate you staying over the, 10, 15 minutes. I appreciate it. Thank you. See you on May 7th.
Thank you.
Okay.
Thank you all. Have a
Thank you.
great
Bye.
day.